Rosacea is a very common chronic condition. It is characterized by, there is redness, there is inflammation. Also, the patients do complain of itching. So, it's most commonly seen in females because the hormone involvement being common. So, prolonged sun exposure, which it leads to already the skin is inflamed, and further it just tends to irritate it. So, these are the most common features. Secondly, what happens is like, as a hormone is involved, so the females especially do also complain of, there is increased redness at the time of menstrual cycle. So this is also very common. And then as hot, spicy foods, stress, emotional disturbance, they also tend to affect. So it's like external as well as the internal, both the components are involved in rosacea. So rosacea, it is mild, moderate, and severe. We can basically, classify it for our understanding. So in a mild form, it basically presents with transient flushing. So the flushing occurs if there is, too much of sun exposure or stress. Otherwise, in the more moderate form of rosacea is basically characterized by, there is persistent redness and swelling as a result of overexposure to stress or some, spicy foods intake, the menstrual cycle being there. And then the third case, which is also known as, thickening, which is has given a medical term, which is known as pyomatous. The skin becomes thickened, and most commonly nose is involved. So in medical terms, we basically name is that erythromatogenic rosacea, papillopustular rosacea, and pyomatous rosacea. So as I explained, these are the three types. Plus ocular involvement is also seen, and ocular involvement mainly it involves the eyes, which leads to redness. Then there is dryness, there is irritation. The patients do complain of, such eye symptoms along with the skin symptoms. So triggers, it's basically food items are also there. Okay. So in food items, mostly it's like having hot, spicy food. It's not for everyone, but the people who already have rosacea tendency, they should be careful. So avoid eating too much of spicy foods. Then also having hot beverages like hot coffee or hot tea frequently. Secondly, some citrusy fruits are also, causing rosacea tendency in some people. Then also, you can see it is being linked to gluten allergy. Those who are allergic to that, they might also get flare-ups. Also, milk products, dairy products, basically. So these are the most common, rosacea triggering foods that the people have to avoid who are prone to such flare-ups. For rosacea, we need to see proper medical history. When the patient comes to us, we just examine him, asking about any other allergic histories, and when all the episodes are noted. Secondly, a dermoscope also helps. Dermoscope helps to just visualize the skin in a very nice, zoomed picture. So we can get to see the telangiectasia, which is known as dilated blood vessels. There is inflammation, which can be seen more clearly. Plus, if needed, we can do a skin biopsy as well to just rule out it from other similar conditions which can mimic rosacea. So rosacea, it can be treated either topically, which is the first line treatment. If it is severe, we can combine it with the help of oral medications also. And then plus there are new treatments which are in the form of lasers and light. So for topically, what most commonly used and first line treatment and FDA approved is, metronidazole, which is a gel form. It's an antibiotic that can be used. It has to be used for roughly about 6 months for the results to be seen because as rosacea has got its own episodes. It's not like you're treated and it's gone forever. Depending on the hormone, depending on the stress, it can again flare up. So we just need to keep a watch. And whenever the episodes are, the patient has to start using it. But roughly, no, on an average, at least 4 to 6 months is what is needed for the metronidazole. Then there is azelaic acid, which is also used. It is naturally derived, so it can just help to soothe the skin, the redness, the inflammation. That is another one. And then orally also it can be treated if it is not no first line topically we try, but if not control, then we can definitely try with oral medications. Oral medications again, metronidazole is given. And then for lasers, as intense pulse light laser therapy is proving very much beneficial for all the rosacea patients, because you can't do too many things. The skin is already irritated. The skin needs to be smoothened down. The redness has to be calmed down. So intense pulse light laser is, the sessions are needed, which just help to the blood vessels which are already dilated. We just help to just suit it down so that the patient also doesn't get any side effects, and it just skin just feels more better, and just to prevent from all the irritations the patient goes through. Foods to avoid in rosacea, especially hot beverages like coffee, tea, also red wine, because it just dilates the blood vessels further. Secondly, anything which is spicy, too spicy foods, then citrusy fruits, tomatoes. Also, some people are allergic to gluten products, dairy products. They also tend to, there are instances where the patient have complained like after consuming such foods, people do get episodes and flare-ups. So such foods should be avoided. Prevention of rosacea, the first and the most essential step is, we actually ignore it, but it's the most essential one, is to use sunscreen, which is broad spectrum, at least 30 SPF, but anytime more than 30 is better, like SPF 50 plus. That has to be used and that can't be skipped. This is the single most essential step. Secondly, avoid, as I told you, avoid eating too spicy food. In if there is lot of stress going on, or menstrual cycle, that we can't help, but at least during such period the people or patients should avoid eat consuming spicy foods. And then these are the basic steps which can be taken care of.